Hi, I'm Dr. Christine Anderson, or Dr. Chris as my patients call me. I am a chiropractor who specializes in pediatrics and pregnancy with a subspecialty in functional neurology focusing on childhood developmental disorders. So for me, it is all about the brain, and I am doing this series on primitive reflexes so that you can understand this really important foundation of the brain, starting from as babies are developing in utero and also at birth, not only to help them be born and survive, but to thrive and to help the brain develop. So in this series, I'm now going to talk about the Babinski reflex and the plantar grasp reflex because they have similar effects if they are not present and if they are not being integrated and are retained. So I'm putting them together because of this. So if your child has things like toe walking, or maybe delayed walking, an odd gait, poor balance, maybe they fall a lot, sensory issues or learning issues, maybe they have a retained plantar grasp reflex or Babinski reflex. So let's dive right on in. I just want to remind you that in this series, I started it off with a video on the neurologic reflexes, an overview not only of the primitive reflexes, but of our entire reflexive system. And then I did a video just talking about primitive reflexes in general. And I do highly recommend that you watch at least this video on primitive reflexes after you watch this video that I talk about Babinski and Plantar grasp. And I'll put the descriptions in, or the link in the description. And also I am creating a slideshow of all the videos so you can look for that as well. All right, so let's dive right on in with the plantar grasp reflex. So I talked about the palmar grasp reflex in a previous video, and that's where you would touch the hand and the fingers curl, when plantar, which is the foot in medical speak, is where you would touch the ball of the foot, usually with the thumb. And here you can see in the picture, the baby's toes are curling downward. And this does develop in utero about 11 weeks, and then the baby's born with it, and will continue to have this reflex throughout the first year of life. I'm going to go into more about this, but basically the essence of what this reflex does, the purpose, because humans don't really need it. Like with monkeys, their toes will grasp their moms to hold on to them. Well, children don't really need that, but it will help them with exercising their toes and feet, and even later on their entire leg. And this is part of what primitive reflexes do, is that they stimulate a body to move that doesn't have a brain that's already built to move, if you catch my drift. And I go into more of that in the primitive reflex video. It's going to help with this motor planning, that top-down control of the brain, which is necessary for movement as well as learning. And it's also, this particular reflex is going to help inhibit the Babinski reflex when it is time for that to integrate. And you're going to see in a second why. So with the Babinski reflex, the opposite is occurring with the toes. When the foot is stroked on the outer part, so I'm just going to grab my little baby here. Hello. Oh, baby's sleeping. All right, so this is the pinky side. When the foot is stroked from the heel to the pinky, and the typical test goes all the way across, but usually it's enough just to do it here. The big toe is going to extend up instead of flexing down like that grasp. and the other toes are going to fan out. So that is what we would consider a present Babinski reflex. It is present at birth. And again, it's going to help exercise the baby's toes and the feet. And there's an aspect of this to commando crawling. So when a baby's on their tummy, they can push with their toes. I call it toe dig, to push themselves along mom or the floor or whatever, because newborn babies, believe it or not, if you put them on mom's belly, they will push themselves up to the breast using this reflex. And so that would definitely be a source for survival, to have baby engage this reflex to be able to get nutrition. It's also going to help determine the adequacy of the central nervous system. So what do I mean by that? Well, the central nervous system is comprised of the brain and the spinal cord, and that's the central part. The peripheral part is the nerves that come out to the rest of the body. So it's that top-down control of what the body is doing, and this is really what the Babinski reflex ultimately is able to be integrated and inhibited by, is the top-down control of the brain. So it's involved in and tied into the sensory system, the vestibular system, which I went into in the tonic labyrinthine reflex. If you want to go into that, that's the inner ear. And also the proprioceptive and visual systems. And it also is the aspect of beginning of gross motor skills, which, again, like I said, this is when babies are born, they have this reflex. Well, gross motor skills begin in utero and at birth and will continue developing throughout their life, but especially in those first 2 years of life. So this is crucial to brain development. So what happens if your baby is born and your medical pediatrician is checking for the Babinski reflex and the plantar grasp reflex, or maybe you've got a pediatric chiropractor who's checking? What if it's not present? What if it's the toe doesn't fan up, or for the Babinski, or toes don't go down for the plantar grasp? Well, what they would say medically is that at this stage of life, it doesn't really give them a good indication of whether there's any overt neurologic disease, in other words, pathology, because the brain hasn't developed yet. And I'll talk a little bit more about that when I talk about the retention, because it has to do with the maturity of that brain stopping the reflex, and then if it comes back, well, then there's a problem. So we'll talk more about that. But in my world, primitive reflexes are found in the brainstem. The brainstem is the connection between the brain and the spinal cord, and it is the bottom rungs of the ladder of that brain development. And if you are not seeing a Babinski or plantar grasp reflex, or one side is present and the other is not, well, it could possibly be due to compression or irritation of the brainstem where these primitive reflexes lie. And you may see some other reflexes that are not present either. So I go into this in more detail, talking about things in the pregnancy and chiropractic video as in regards to in utero constraint. What does that mean? It means the baby isn't fitting in mom's tummy really comfortably. Let's put it that way. Obviously they're fitting, but not very comfortably because of possible pelvic misalignments in her. That's affecting their positioning. And that might lead to birth trauma and interventions, and even possibly a C-section, because let's just say the baby is in a breech position. Well, protocol now is that mom would get a C-section for the baby to be born. Well, all those things create more chances for birth trauma, and that can occur either at that brainstem or, in this case, with Babinski and the plantar grasp reflex, the motor component that makes the toes either flex down or come up has to come off the lower lumbar spine in the low back or the sacrum, depending on which thing we're talking about. So with a frank breech position, you've got those knees tucked in, the baby's head up, and it can have effects on the pelvis and the hips, and even how that baby is moving once they are born. And this is all things that I check out. So there's a lot that goes on here that you might not think about, and medically may be overlooked because medical doctors are not trained to look for these things. It's just not in their repertoire, which is why a pediatric chiropractor, I feel, is an essential part of your child's team to help them grow up healthy and happy. So this is where chiropractic and craniosacral therapy comes in, and I'll put a link to the description that I had done on the video on craniosacral in newborns, which goes into more of the detail on this aspect of brainstem compression, so you can have a look at that. But the chiropractic and the craniosacral, all that I'm doing is removing any interferences to that communication between the brain and the rest of the body, with the craniosacral system involving the top and the bottom of the spine, with the brain, with the coverings around the brain being affected. So like I said, you can check out that video if you want to learn more about it. All right, so let's talk about why this is so important for the baby to have these reflexes, and then they need to go away. So they appear like they go away, but they really are always there. They just integrate because the brain, in its development over that year, starts to have top-down control and says, whenever somebody touches the bottom of your foot, you don't have to bend your toes under, or you don't have to splay them, depending on how you're being touched. Right? Top-down control. You're not just at the mercy of who's ever touching your feet. So this is why it's reflecting that maturity and integrity of that brain development, which is super important. Not only that, but it's going to affect what's going on with the feet. So you've got your foot arch development, and this is going to be occurring over the first 3 to 5 years of a baby's life, starting with as they become weight bearing. So think about this. If your baby's Babinski or plantar grasp is not integrated and they go to try to weight bear, what might happen is their toes might lift up if they are stimulating Babinski reflex, or the toes might curl under. And that is not going to give them a very good foundation for the rest of their body. It's going to be very wobbly. They're going to have really hard time with balance and coordination. They might not even want to stand. Very hard to do this. So the grounded walking, in order to have that flat foot, and babies do have flat feet, so it's okay when they first start to walk, that flat foot gives the brain information about where the rest of their body is, where the feet is, where the rest of the body is following, and they can feel very grounded, and that's why, too, they have a very wide base gait. This is an ability to keep their balance a little bit better until they get better at walking. So it's with the coordination, if you're not having a really good foundation, think about when you're on a boat, okay? And there's rolling waters and you're just trying to stay, on your feet. How are you supposed to get coordination with the rest of your body movements? You can't. You're like going to the side, you're like almost going to fall over. So this is kind of what happens if you don't have this integration is you can't then get coordination with the rest of the body movements, like the hand-eye coordination or eye tracking, which always follows what's happening with the head too. So if the head is tilted or moved, the eyes are going to shift their position, and then the eye tracking is going to shift. And then there's the whole aspect of sensory integration. So if the brain is not receiving the best optimal information about where that body is because it can't get that nice flat foot position, then the brain isn't going to know what to do to adapt to its environment, and then there can be some problems with sensory integration. So let's go into the retained Babinski reflex first. So this usually occurs about 12 months. Well, this is when babies start to walk. They start to get up on their feet, they start to cruise, and then they're going to start walking on their own. So what usually happens is the same thing when you stroke that outer edge of the foot from the heel to the pinky. That big toe may extend up, just like in the picture I showed you with the toes fanning out. Maybe yes, maybe no. Maybe that foot is going to dorsiflex. That's what we call flexing back. So in other words, I'll use my little baby here. So it comes back this way. Or maybe their whole leg is going to bend, right? It's the withdrawal reflex. It's like, get away from me. They might say they're really ticklish and be squirming all over when you do this. Now, I have at the bottom here, maybe a sign of cerebral palsy. I want to make just a note on this. That is only if this reflex stays retained when you start doing the remediation exercises. In other words, you keep stimulating the Babinski and it is not integrating, because cerebral palsy is a problem with brain. Now, depending on where the issue is, will depend on what the problem is. So if it's in the motor area of the brain, they may have trouble with moving their body properly. So this is something that is not, I don't typically see it, but it's not what I'm thinking of at age 1. I'm thinking more if this is when the child is age 2 or beyond, and we can't get this to integrate. And usually there's other things as well, not just Babinski. So don't get worried about that. But I did want to put that in there because it can be a concern. All right, let's move on. Now for the retained plantar grasp reflex, same thing. When you push the ball of the foot right underneath the toes are going to curl under. And that can happen in an older child as well. Or they might not curl all the way down, but the foot might be sensitive or painful. Or they may do things like curl their toes as they go to put their shoes on. Or even standing, like when I'm checking posture out, and they'll like curl their toes under and to try and help keep balance, because that reflex is being stimulated. So it becomes very, very unstable. But you might notice these things in your child. So what else might you see in your child? Well, maybe late walking. Like I said, they might not want to walk. It's just not comfortable. It could even be painful. Or, especially with Babinski, they might do toe walking. And this is because, remember, pretend this is my foot. When we start the stimulation, we're here at the side of the foot. If you come up on your toes, you're not touching your foot on the ground. So you're not stimulating that reflex. So it's a workaround. They're just trying to adapt to their situation. It's just like, yeah, I don't feel comfortable walking on my feet, so I'm going to go up on my toes. Now, there are some other primitive reflexes that also may look like toe walking, including the tonic labyrinthine, but this is one I find very, very common. There's also a link with language impairment and toe walking because of what happens with the posture, and their jaw gets really tight and they might clench, and so they're not using their full mouth and opening and making the sounds using everything they have. It might be mumbled or very hard for them to use their tongue. They might have odd gaits. I mean, I hear this all the time from parents. It's just something. I don't know what it is, but they're walking funny, or their feet are out, or maybe they're limping. Maybe they are running awkwardly. So with the arches of their feet, they might have pain there. The backs of their legs are usually affected and really tight, which will affect how they're using their foot and walking. So this is another thing that you can often see with these retained reflexes. You might see them falling frequently or tripping over their feet. They're running, fall, running, fall. And this is not in a child that's just learning how to walk. This is one who knows how to walk. They might be, a little bit older, maybe 4 or 5. They just cannot ground their feet. They're just not able to access their proprioceptive system of where their feet are in relation to their body. And they may also have reoccurrence of twisting their ankles, which is very common, by the way, if you are one of those chronic ankle twisters. Not that you have this reflex retained, although you might. But once you injure your ankle, the proprioceptors in there need to be retrained as to where your feet are, so your brain knows, so you don't keep doing it over and over again. So it has to do with proprioception. They have trouble balancing and coordination. They're not going to like sports that require these two things. They might even bump into things in the night because they can't use their vision to figure out where they are. They are not able to use their body, both sides. They just can't integrate that. And they're also probably going to have issues with poor gross motor coordination. Those are the big trunk muscles for movement. So with that trouble with the balance and coordination, also what happens is because they can't ground themselves and things start at the feet, they might have posture issues. They might have the knees knocking in or knocking out, issues with their hips or spine. Kids don't usually have these issues, so if they do, there is definitely something going on, especially if they have pain in their feet or shins and their low back. So this is another sign something might be going on with primitive reflexes. It might be something else, but it's certainly worth checking out. Now, as far as the trouble with the vestibular, visual, and sensory system, like I said, they're going to have those tracking challenges, hand-eye coordination, sensory issues, sensitivities, because it's going to be hard for them to interact with their environment. They're not getting that input into the brain that the body can adapt to, and it's also crucial for learning to get the proper information in. And then this can make them kind of timid because they're unsure of themselves in their world. All right, so let's get to remediation. Well, surprise, surprise, you're going to be stimulating the Babinski reflex. On the outer sole, so you can see that picture from the far left, that's a reflex hammer being used. Now, traditionally, you would, when you're testing, you would take it up to the pinkie and then across the ball of the foot, but you really don't need to for this exercise. It's usually enough. So if you stroke and that big toe goes up and the toes fan out, that's a positive sign. That means that reflex is present. So you want to do that at least 10 times, but if you can, you want to do it until that big toe stops going up and the toes might even go down. And that's that picture on the right-hand side where it says negative. If you are stroking and you're getting the toes down going, or the foot just stays still, then you're done. And you want to try to do this as much as possible whenever you're working with primitive reflexes. The more you do it, the faster it happens, because you need to stimulate these reflexes like 1,000 times for the brain to go, oh yeah, all right, we got this. So you really do want to do as much as possible. Now for the plantar grasp, all you need to do is use your thumb or thumbs if the child has a bigger foot and press right on the ball of the foot. So we've got the little baby there, but any size foot will do. And you want to hold the pressure for about 10 to 15 seconds. And you can do it 3 to 4 times or until that reflex starts to dampen, because it will as you do it, and then next time you go to do it, it might be back again. So it might take a little bit of time for this to happen. All right, a couple of other things you can do, little games to do for older kids. Things to do with the feet. So picking up objects with the toes. There's a couple of examples here where the child's sitting there with the little toys, picking them up with the toes and putting them in the bowl. So you can do that. There's a picture there with, this one is actually an adult, but it doesn't matter. Any age that can take direction, obviously. That's a reflex hammer, but you can do a pencil or Lincoln Logs or whatever to pick it up, release, go to the other side, and keep going back and forth. You can have kids write with their feet. You can have them, do letters like with their toes, or you can have them dig with their feet, like get them in the sand and actually have them do digging. And speaking of sand, it is really good to get these kids' feet into different textures. So out in the grass, which is really great for grounding, by the way, in the mud, in the water, you can try different textures of like sandpaper and fake grass and those balls with the little spikes on them. You can get them to try and pick something up like that. You can be very creative and let them look for things to pick up if they're old enough to do it. The purpose is stimulating the bottom of the feet and getting them to use those feet. By the way, just going back to the exercise, I want to just go back for 1 second because I didn't really talk about what you can use. They're using a reflex hammer. What I will, even though I have a reflex hammer in my office, oftentimes I'll just pick up a pen and retract it. And I'll show the kid, I'm like, I'm not going to draw on you. You can use a marker with the top on. You can use the eraser side of a pencil. You can use a paintbrush. I oftentimes just use my finger with a little bit of nail, just a teeny bit. You don't want it to hurt, but I do want to get a little bit of scratch on there. So you can even use the handle part of a utensil. Nothing that's going to dig in, not too hard, but you do want to do it repeatedly. I like to do it as fast as possible to really get this reflex stimulated, and as much as they'll let you. And also I will stand on the side, and I'll hold on to their leg while I do it, so that if they're bucking and moving, I don't have legs flailing all over the place. Oh my gosh. All right, so let me just move on here. So this is my information. If you'd like to contact me at my website, losangeles-chiropractor.com. I've got so many links there. It's got links to all my YouTube channels and podcasts. with my specialty, I am helping kids. I'm trying to help as many as possible, and this is why I'm doing these series, but also I'm trying to set it up so I can help remotely. So if you have a need for my services, just contact me. I'll see what I can do if you're not in LA, what I can do remotely, and possibly connect you with other people. But I have a lot of services that I can do remotely, so you can check that out on there. And of course, if you found this helpful, just give me a thumbs up, please. It does help. And you can subscribe and get notifications so you know when I'm posting videos. And please share with those that you think might find this information useful. All right, until next time, bye.